Tour, and we're here with Dr. Iman Bar, and she's going to talk a little bit about bioidentical hormone replacement therapy, specifically testosterone.
Thank you for having me. And testosterone is a great hormone. It's a feel-good hormone, and it's an anabolic hormone. And occasionally, people don't think about it as any other anabolic hormone more than it's a sex hormone. However, it is a great hormone for all kinds of cells in our body, has hundreds and hundreds of functions. So, for example, it's very important for the mood, for memory, for strength, for leadership, for muscle building, for bone health, for cardiac. Of course, all the other sexual benefits that come with that, but it's not only for men, it's for men and women. And we have abundance of it when we mature and we're at the peak age. And then unfortunately in late 30s and 40s people start having less of that hormone, and unfortunately slowly, very slowly, they have the decline levels and maybe they won't feel the changes, but it happens at a young age, unfortunately. 40 is too young for us.
Yeah, that is very young, actually.
Yes.
So if someone's deficient in testosterone, how would you go about finding out that information?
Sure. So a lot of times we do blood tests. It's very easy. We can even do a finger prick. It's very simple. We can do it in the office. We can find the results within a day or two. It's a very simple test. There are other tests that we can do as well, but of course we check for the symptoms. We do a questionnaire consultation. Symptoms are very, very key. And one of my first symptoms for men, I would say, is they lose their morning erections. So that is not even needing to be drawn as a blood level.
Right.
And for women, losing the libido and the sex drive, which happens a lot after having the baby. So there's sometimes decline in that with other hormones. So, but we can do a blood test. It's very easy.
Of course, I have it. And then, what kind of treatments would you do to balance those levels out or increase them through what?
Sure. Of course, I always recommend bioidentical hormone. And you can ask me what is bioidentical. The consensus is it's more of a natural ingredient, that it's not a synthetic like the pharmaceutical ones that are patented and they have to have a different ring of some sort so that it's like patent and making money. But a lot of times these are compounded, could be done with a natural pharmacy, or sometimes they're available in the market. And these are compounded through, most of the compounds here are in yam. We don't do soy in this country. And the best part about using these in pharmacies that would do a prescription for you, customized to the needs. So everybody is different, and every person is not going to take that particular, dosage that pharmaceutical says. Okay, we have 1, 10, and 100, and if you don't fit in between, just choose one.
Right. Yeah. I see that a lot.
Yeah.
So.
Yeah.
And then, would it be like in a pill formation, or what different types of?
For sure, yeah. So if it's for women, it's different for women and for men. And I definitely recommend testosterone for a lot of women. If we are deficient, I like the balance. It's all about the balance. So very important. So balancing our levels to a good, kind of median. I don't overdo things.
Right.
So we want to go where we were in the middle. If we have levels from before, it's great. So for women, for example, it is common. I would use it in a cream. And it could be a little bit vaginal cream. We can mix it with other things, and it's just very enhancing for the sexual experience. So women mostly get creams.
Okay.
And it's okay if the male is exposed to it, so it's not a problem. However, men, it depends on their age and where they are in life. If there's kids in the house, we prefer not to use creams. So we can use some sort of injectables. And there's a new one now. I know men used to hate the injection. They had to take a big muscular injection. I do not recommend them to be like every 2 weeks. That's very unhealthy. We have to adjust the dose. Imagine men make that testosterone twice, maybe a day. Usually there's the peaks. So we don't want to give them every 2 weeks a huge dose and then they just decline. Yeah. So I have a different protocol that I use for men. And there is one now that we can use that doesn't hurt as much as the muscular one. So it's a newer way we've adjusted and adapted for males. I know people talk about pellets. It's not one of my favorite. There's a lot of complications that came from pellets.
Right.
I guess it maybe was of the past more than right now. Occasionally, men are okay with using gels or creams. So it depends, and we put them in areas that nobody's exposed to it.
Gotcha.
And sometimes, they have to clear it off their skin before
makes sense.
being in bed with kids or wife and exposure.
So it sounds like that's something that is definitely a necessity for anyone over, 35?
I would say 35 to look for, symptoms and be vigilant, but probably 40 is definitely a time to be checked. And there's a curve, and we can post that. It's pretty interesting. People maybe are at their 60th percentage of production at the 40s. Yeah. So, yeah, it is concerning.
And like 50 or what, like 30?
40s.
Oh my God.
And everybody will be symptomatic different. So we check other hormones with that.
Got
So
it.
that's the testosterone, and it is one of my favorite hormones because it's a be happy, feel good hormone.
Got it.
Yeah.
All right. Well, thank you.
Thank you.
Can't wait for the next series to see
Yeah.
what else we've got in store.
Yeah, next time we'll talk about estrogen and progesterone for females
Sounds good.
and maybe growth hormone.
Perfect.
Yeah.